Hi, my name's Hannah. I'm a student nurse from the University of Detroit Mercy. Can you tell me your name and date of birth?
Gabrielle Rody, 10/20/1995.
Provide privacy. What are you here for today?
Just a checkup.
Client appears stated age. And do you have any pain?
No.
Any allergies?
Nope.
Mood seems pleasant, alert and oriented times 3, knows why she's here. Well groomed, doesn't look bad, showered, or dressed appropriately. No signs of illness. Alright, can I do a head to toe assessment on you today?
Yeah.
Okay, I'm gonna start with your head. Well showered, no lice or anything, no dirtiness. Warm to touch, no lesions, and if there are lesions, I would check the ABCDE rule. Alright, can you look straight ahead for me? Eyes are symmetrical, pupils are equally round and reactive to light and accommodation. I'm gonna check your conjunctiva. Pink and moist, so that's good. I'm gonna check your mouth now. Can you open wide? Oral mucosa is pink and moist. Tongue is pink and moist. No white dots or any signs of illness. Can you smile for me? Gums are healthy and not retracting. Can you open up one more time? And say ah. Uvula vibrates speech. Tonsils are 1+ bilaterally. Can you tell me, I'm going to check for cranial nerve 5 and 7. Can you tell me where I'm touching you?
Forehead, cheek, chin.
Can you smile? Puff your cheeks. Cranial nerves are intact. Face is symmetrical, no drooping, no signs of that. All right, I'm going to check for your carotid. Carotid pulse is 2+ bilaterally. I'm going to listen for any bruits. No bruits present, and do not have any jugular vein distension, which is good. Alright, I'm going to check your upper extremities now. Skin is warm to touch, moist, no dryness. Alright, I'm going to check your brachial pulses. Brachial pulses are 1+ bilaterally. Your radial pulse. Radial pulses are 2+ bilaterally. Skin is appropriate for ethnicity. Capillary refill is less than 3 seconds on both hands. No signs of clubbing or anything. Can you grasp my hands, please? Great, perfect. I'm going to listen to your heart now. At the right second intercostal space is her aorta. The left second intercostal space is her pulmonic. Third intercostal space is her Erb's point. Tricuspid is the left sternal border. And the mitral is her fifth intercostal space. I would listen here for a minute to get her apical heart rate. No sounds of bruise or any murmurs or arrhythmias. I'm going to listen to your lungs now. Can you take a deep breath? Can you lift up your arm? Lung sounds are clear, no adventitious sounds. Alright, I'm going to test your for costovertebral angle.
Okay.
Any tenderness or anything?
Nope.
Nope. Alright. Patient doesn't have barrel chest. It is ratio 1 to 2. Can you lay down for me? I'm gonna inspect for any lesions or anything. Looks good. No lesions. No scars or anything. And I'm gonna listen to her all 4 quadrants to make sure there are bottle sounds. This is the right lower quadrant. Right upper. Left upper. Left lower. Vowel sounds are present in all 4 quadrants. Now I'm gonna listen for your vowel sounds in your liver and spleen. Sounds good. And then we'll just feel your stomach and tell me if there's any tenderness. No.
No, nothing.
Alright, in the patient's right lower quadrant, there is her appendix, ascending colon, her cecum, and ureter. In her right upper, there's her liver, gallbladder, kidney, and part of her colon, her ascending and transverse. And then in the left upper, there is her pancreas, spleen, her transverse and descending colon, and a kidney. And in her left lower, there is her sigmoid colon, her descending colon, and her ureter. In midline is her bladder, her umbilicus, and the aorta. Can I have you sit up? Thank you. I'm gonna check your legs. No signs of scarring, lesions, or anything on her legs. No hair. Little dry, but not that bad. And there is no edema bilaterally. Alright, I'm gonna check for your popliteal pulses. Can you move up one? Thank you. Popliteal pulses are 1+ bilaterally. Your tibial pulses. One plus bilaterally. Do you mind if I take your socks off?
Yeah.
Dorsalis pedis pulses are 1+ bilaterally. Right, I'm gonna test your reflex. No Babinski reflex, which is good. Right, can you stand up for me? Yeah. Right, can you stand with your feet together, arms by your side, and close your eyes? Alright, good. Can you walk to the corner and back, please? Normal gait, no dizziness. It seems good. Can you bend over for me with your arms now? Spine is in the reverse S shape and healthy. Thank you for your assessment today.
Yeah, you're welcome.
You can change and get dressed.